Osteoporosis is a medical condition in which your bones become weaker and more fragile than normal. The term osteoporosis literally means porous bone. Under the microscope, healthy bone looks like a honeycomb, but in osteoporosis, those spaces in the honeycomb become much larger. This loss of bone density makes your bones more prone to breaking, even with minor falls or in some cases simple movements like bending over or coughing. The condition is incredibly common, especially in older adults. In fact, it's estimated that over 10 million people in the United States alone have osteoporosis, and many more have what's called low bone mass, which puts them at risk for developing it. Women, especially those past menopause, are at higher risk, but men can develop it too. And here's something important. Not everyone with osteoporosis knows they have it until they suffer a fracture. So let's start by understanding what causes osteoporosis in the first place. Bone is a living tissue. Throughout our lives, our bodies are constantly breaking down old bone and replacing it with new bone. In children and teens, this bone building process happens faster than bone breakdown, so bones become stronger and denser. Most people reach their peak bone mass in their late 20s or early 30s. After that, especially for women after menopause, bone loss tends to outpace bone formation. When this imbalance continues over time, bones become thinner and weaker. That's osteoporosis. There are several risk factors for osteoporosis. Some of these we can't change, like age, sex, family history, and genetics. Others, like smoking, excessive alcohol use, a diet low in calcium and vitamin D, and a sedentary lifestyle, are modifiable. Certain medical conditions and medications, like long-term use of steroids, can also increase your risk. Now, let's talk about symptoms. One of the tricky things about osteoporosis is that it's often called a silent disease. That's because you usually don't have any symptoms until a fracture occurs. People with osteoporosis may not realize they have it until they break a bone, most commonly in the hip, wrist, or spine. Spinal fractures can be especially serious. Sometimes the vertebrae in your spine collapse slowly over time, leading to height loss or a stooped posture, often referred to as Dowger's hump. In more severe cases, these fractures can cause chronic pain and limit mobility. That's why screening is so important. Catching osteoporosis early can help prevent fractures before they happen. The most common screening test for osteoporosis is a bone density scan, also called a DEXA scan. It's a special type of low-dose X-ray that measures how dense your bones are, typically at the hip and spine. The results are given in the form of a T-score. A T-score compares your bone density to that of a healthy young adult. A score of -1 or higher is considered normal. Between -1 and -2.5 is classified as osteopenia, which means you have low bone density but not low enough to be called osteoporosis. A score of -2.5 or lower is considered osteoporosis. The U.S. Preventive Services Task Force recommends that all women age 65 and older have a bone density test. Women younger than 65 should be screened if they have risk factors. For men, the guidelines are less clear, but screening may be considered for those over 70 or those with risk factors for bone loss. Now let's talk about management and treatment. If you're diagnosed with osteoporosis, the goal is to reduce the risk of fractures by strengthening your bones and improving your balance to prevent falls. Lifestyle changes play a big role. Let's start with calcium and vitamin D. These are essential nutrients for bone health. Adults over age 50 are generally advised to get around 1,200 milligrams of calcium and 800 to 1,000 international units of vitamin D per day, though individual recommendations can vary. You can get calcium from dairy products like milk, cheese, and yogurt, as well as some leafy greens, almonds, and fortified foods. Vitamin D comes from sunlight, fatty fish, and fortified foods, but many people need supplements, especially those who live in colder climates or don't spend much time outdoors. Exercise is another crucial component. Weight-bearing and resistance exercises like walking, jogging, dancing, lifting weights, or using resistance bands helps to maintain or even build bone density. Balance and flexibility exercises like Tai Chi or yoga can reduce your risk of falls by improving your coordination and strength. In some cases, medications are recommended. The most commonly used class of drugs is called bisphosphonates. These include medications like alendronate, risendronate, ibandronate, and zoledronic acid. They help slow bone loss and reduce the risk of fractures. Some are taken weekly or monthly by mouth, while others are given by IV once a year or less often. Another option is denosumab, an injection given every 6 months. It works differently from bisphosphonates but also helps reduce bone breakdown. Medications are also recommended if your estimated risk of major osteoporotic fracture is greater than 20% or your risk of hip fracture is greater than 3%. For people with very low bone density or a history of multiple fractures, other medications like teriparatide or baloparatide, which actually help build new bone, may be prescribed. These are typically reserved for more severe cases and are given as a daily injection for a limited period. There are also selective estrogen receptor modulators like raloxifene and, in some cases, hormone replacement therapy for postmenopausal women, though these options come with their own risks and benefits. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, fall prevention is another major part of managing osteoporosis. Because fragile bones can break more easily, avoiding falls becomes crucial. That means making sure your home is safe by removing loose rugs, improving lighting, installing grab bars in bathrooms, and wearing supportive shoes are important. Some people also benefit from physical therapy to improve balance and gait. Let's not forget that osteoporosis isn't just a women's issue. Men are often underdiagnosed, but they also face serious complications from fractures, especially hip fractures, which can lead to long-term disability or even increased risk of death. That's why awareness and proactive care are so important for everyone. What about prevention? Well, it's never too early or too late to start taking care of your bones. If you're a parent, helping your kids develop strong bones through good nutrition and activity is a great foundation. And as adults, we can all benefit from healthy habits. Staying active, eating well, avoiding smoking and excessive alcohol, and making sure we're getting the nutrients our bones need. So osteoporosis is a common condition that leads to weakened bones and an increased risk of fractures. It's more common in older adults, especially women, but it affects men too. Because it's often silent until a fracture happens, screening is vital, especially for those at higher risk. If you're diagnosed, don't panic. There are many ways to manage it. With the right combination of lifestyle changes, supplements, medications when needed, and fall prevention strategies, you can protect your bones and stay strong, active, and independent. And remember, talk to your doctor about your individual risk factors. If you're over 65 or if you've had a fracture or other signs of bone loss, it may be time for a bone density scan. Thank you for watching. As always, take care of yourself and make the most of your day.